An examination of chlorhexidine bathing effectiveness to reduce central line-associated bloodstream infections in intensive care units. In recent years, increased awareness of the morbidity and potential mortality of infections acquired in the hospital has led to concerted prevention efforts. Laboratory-confirmed bloodstream infections, LCBI, are a primary bloodstream infection, or BSI, therefore, organisms cultured from the blood are not related to infections at another site. Daily bathing with chlorhexidine gluconate, CHG, has been associated with a reduction in CLABSI incidences. Alternative text description: a person with gloves on, utilizing a CHG bathing wipe. A central line, CVC, is an intravascular catheter that terminates at, or close to, the heart, or in one of the great vessels. This line is used for infusions, withdrawal of blood, or hemodynamic monitoring. In a review of daily CHG implementation, an investigation is not intended on a particular device, but to identify risk to the patient as a result of general device use and effectiveness of chlorhexidine bathing in intensive care units on reduction of CLABSI incidence and its causative pathogens. What is chlorhexidine? A mode of action explanation. Alternative text description: chemical formulas showing the two routes for chlorhexidine synthesis. Chlorhexidine is a broad-spectrum antimicrobial with an ability to target and destroy both gram-positive and gram-negative bacteria, fungi, and certain viruses. Chlorhexidine, an antiseptic, works to target bacteria by binding to the negatively charged sites on the bacteria cell wall. This affects the integrity of the cell wall. After damaging the cell wall, chlorhexidine then enters the cell and attacks the cytoplasmic membrane. Damage to this delicate, semi-permeable cell membrane allows leakage of components and ultimately, bacteria cell death. Bacteria cell death can also be caused when high concentrations of chlorhexidine cause the cytoplasm to congeal. A type of bisbegoniide, chlorhexidine is used preventatively as a surgical hand scrub, surgery prep soap, and oral rinse. Chlorhexidine is effective in providing immediate and sustained antiseptic activity with little to no systemic absorption and provides antimicrobial activity for up to 24 hours. CLABSI and quality reports, causative pathogens. The Journal of Hospital Infection presented an intervention utilizing chlorhexidine as a daily bathing alternative. In a review of these findings, the numerical value of CLABSI incidences will be evaluated based on causative pathogens. Specifically, an inquiry into the relative frequencies of Staphylococcus aureus and Escherichia coli. Methicillin-resistant Staphylococcus aureus, MRSA, is caused by a staph bacteria which has become resistant to many of the antibiotics used to treat these infections. Healthcare-associated MRSA bacteremia, in most cases, develops from a primary site of infection. CVC infection is a major cause of healthcare-associated MRSA bacteremia. Bacteremia due to S. aureus has been associated with mortality rates of 15 to 60%. Evidence has shown chlorhexidine bathing can reduce MRSA acquisition and carriage as chlorhexidine is able to ward off opportunistic infections. Daily bathing with chlorhexidine gluconate, within the compliance rate, can be an effective adjunctive control measure for reducing the acquisition rate of infections in the ICU, or intensive care unit, where pathogens are endemic. Experts recommend daily CHG bathing in intensive care units due to the high risk of infection. Specific information from the experiment. Implementation of experiment. In the article, Implementation of daily chlorhexidine bathing in intensive care units for reduction of central line-associated bloodstream infections, daily chlorhexidine bathing is examined in its ability to reduce central line-associated bloodstream infections. In a before and after study, in an ICU in Switzerland, the etiologies of CLABSIs were established and surveyed. The intervention, daily bathing utilizing chlorhexidine of ICU patients with a CVC, was conducted on a total of 5,008 patients. The baseline period continued for 19 months, about 1.5 years, and was followed by an intervention period of 9 months. Findings: the introduction of daily chlorhexidine bathing, during the intervention period, resulted in a decline in CLABSI incidences. Alternative text description: Figure 1. Incidence of central line-associated bloodstream infections, CLABSI, over the whole study period. The x-axis indicates the date, year, month. The y-axis shows the corresponding CLABSI incidence rates, reported as CLABSI/1000 catheter days. The gray shaded area indicates the implementation period for chlorhexidine bathing. In the present study, CLABSI rate decreased to 1.001,000 catheter days. Among European ICUs between 2008 and 2010, CLABSI rate was 3.1 catheter days. Prior to implementation of chlorhexidine bathing, at the study ICU, CLABSI rate was 2.45 catheter days. This data shows chlorhexidine bathing was independently associated with a significant decline, approximately 60%, in CLABSI incidence. The pathogens Staphylococcus aureus and Escherichia coli were both found to have decreased from the baseline period to the intervention period. Staphylococcus aureus decreased from 9.6%, to 0.0%. Escherichia coli decreased from 4.8%, to 0.0%. It could be speculated the effect of chlorhexidine bathing is mainly due to the reduction of skin flora. Therefore, a spread originating from the catheter insertion site is rendered unless likely. Conclusion. Chlorhexidine has a broad antimicrobial activity against both gram-positive and gram-negative bacteria. It is also effective against some multi-drug resistant organisms, as well as fungi and some enveloped viruses. The intervention period showed both pathogens, Staphylococcus aureus, a gram-positive bacterium, and Escherichia coli, a gram-negative bacterium, to have decreased. While quality cannot be achieved through an antiseptic solution alone, CHG bathing, when implemented thoughtfully, should lead to better quality care, improved outcomes, and decreased infectious complications.